going to turn it over to you.
Okay. Well, thank you so much for having me. I appreciate the opportunity to share. Um, I work at a 100-bed hospital. We're in a rural community. We have 15 clinics under our hospital guidance. We have hyperbaric therapy, infusion therapy, oncology. We have a vast, wide range of services that we offer. And under my umbrella, like she said, I have quality, risk, and education. So I have myself, a quality coordinator, a risk manager, a nurse educator, and then a community clinical educator. So I have a very great team and very, very grateful for the experience that we have on our team. So just to start us off, next screen, risk management, just the, a good definition is what puts us out there and how can we minimize that risk. It's a systematic process of identifying risks, situations, circumstances, practices that may result in injury or loss to our patients, our visitors, our employees, or the organization as a whole. Meanwhile, we are constantly trying to, strive to reduce those risks. Next slide. Some of the types of risk that puts the organization out there is operational risk, clinical, patient safety, strategic, financial, our staffing, our providers, legal, regulatory, technical, and hazardous risk. And just some of the experiences that we've had recently is a hurricane. We recently were hit with a Category 5 hurricane several years ago. Even sooner than that, we have had we had a tornado in January that really put us out there. We've also had a cyber attack. We've had several other major events that potentially puts our hospital out there. So our risk management program here at the hospital, it takes, there's a lot of characteristics to a program that you need to have. We got to have a structure and be able to function widely in the organization. There's legislative and regulatory mandates that we have to maintain. And then in some states you have to have an internal risk management program. And in the state of Florida, we are one of those. Standards for accreditation include risk management. We also got to have policies and procedures so everybody knows what the risk management program is like and we have to evaluate it just to see if our program is successful at the end of the day. Okay, next slide. Okay, there we are. So some key attributes of a risk management program is, being involved, being, in the business side of the equation, the clinical side. So it puts you anywhere from A to Z. But some of the characteristics that we need is we need authority. We need our teammates and our colleagues to respect our program, to respect our department. We must be visible so everyone knows that you're part of the team and that you are a key player. And communicating, very, very one of the most important things. And I think that's what a lot of hospitals and departments struggle with is that communication, but it is key. Coordinating. You got to have coordination, got to have a plan. We have to be held accountable as well. We must have senior leadership support and commitment, access to the C-suite. we need a clear defined mission, vision, and values. Must have a risk management plan to we have to plan our work so we'll know what we're working on and where we're headed. And also a patient safety plan, even more specific. Engage staff and physicians. We want to have a culture of safety where staff feel like they can reach out to you if they need to. You want to have an environment with a just culture where it's not punitive when you report something. Teamwork, that's like absolutely valuable, is great teamwork, and I absolutely do have that here at my facility. Next. Characteristics of a risk manager, it's number one for me is someone that's compassionate. You play a vital role in patient safety, employee safety. So it's very vital to be able to put yourself as a patient or as a staff member that's hitting the front lines. You want to be trustworthy. There's a lot of information that's very sensitive that the risk manager is privy to, and we must be trustworthy in our work. Proactive, thinking outside of the box, thinking ahead. There's oftentimes in these small, in a smaller facility where you are reactive, but if we can get ahead of the game, then that can save time later or different issues or safety issues that could come up. But thinking outside of the box is probably one of the, a great quality to have as a risk manager. And one thing that I did early on was I went to all the different departments throughout the hospital and sat down and I'm like, tell me what you do. How do we all intertwine together, and, show me your role so I can understand how it comes from your perspective. Be organized. I make a list in the mornings when I get to work, and try to stay on track. That way you can, use your time wisely. Oftentimes we're a mediator, a counselor, being reliable and following up when someone comes to you or an issue arises. Being adaptable. You never know. You may start out on that list, but you may have to deviate from that list. And prioritizing our work. And being patient with the staff and with our team, and with patient complaints and different events that come up, we have to and being patient with our providers, our patient physicians, and then being resourceful. In the beginning, I thought, I've got to learn all these regulations. I've got to know all the answers whenever I'm called upon. But be a resource, but also we have to rely on resources as well. Just always be, and know build those relationships to where you have team members that you can rely on. Next slide. So in our facility, the risk managers' key responsibilities are participating in the hospital teams, daily safety huddle. We have that every morning, and the risk manager is on that call, and we can share events that's happened and safety issues that have come up recently. So it's very valuable and very it's a great communication tool for us to have that every morning to share with our teams. Employee leadership and safety council. Our patient safety council is a frontline staff team that if there's an event that has occurred or something that they're seeing, that team is a team that can work on having a platform to present. Environment of care, we're on that team as well. process improvement team, quality assurance, and then our physician practice committee, since we have the 11 different practices on under our hospital belt, we are on that committee as well, because we also do quality and risk management for them. One of the probably the thing that we probably do the most is review and investigate safety reports. Then we have patient complaints. We have to follow up with those patient complaints, investigate events as they arise, coordinate physician, nursing, and clinical peer review, and facilitate regulatory reviews from whether it be from our accreditation body, our state agency, CMS, OSHA. We play a key role in that. We facilitate root cause analysis, apparent cause analysis, and follow back up. That's very key to your program being successful. Educate staff, physicians on risk management activities, and that's ongoing all the time. And continuously monitoring these high risk areas. Recently, I had a risk manager that's in our department now, and she's like, "What do I do? What do I do?" And I'm like, "Well, you have an 18-month-old. If you go to your friend's house, the first thing you do is you analyze the room. You look at all the different things that your toddler could get in." So that's kind of what we do here at the hospital when we're managing risk for our patients. We're analyzing, looking, seeing what can harm a patient or what could come, what could have a negative outcome. So we guide our safety plan here at our hospital around the hospital national patient safety goals put out by the Joint Commission. We have quarterly planned education for the safety goals. We'll look back a few months before and see if there's any events or any occurrences that that's specific to each one of these or one of these, and maybe pick something that we've had an issue with. We recently, in March, we did timeouts and consents. We usually set up education boards in our cafeteria. Everyone goes to breakfast and lunch, so that's a great opportunity to educate at that time. We usually do puzzles, crossword puzzles. We have drawings. This last time we had, since we were doing timeouts, we had the old-fashioned operation game. And if you participated in the operation game, your name was dropped in for a drawing. So that was a really good, fun time, and everybody kind of reminisced on that old game from some of our years back where we played Operation. Next slide. So some of the high risk areas that we focus on, or that is patient falls, medication errors, infections, equipment that fails or we're not using it properly, not using our policies and procedures as we should, maybe work injuries. Big thing now is patients at risk for suicide. That is such a high risk, and we have we have a program that we monitor these risks, and every day on that safety huddle call, if there's a patient on suicide risk precautions in the ER or in our SCU, that manager will, let us know, and then we go in and we make sure that we have all of the documentation that we needed for the risk assessment, and so that one is a really high risk area that we monitor very closely. Workplace violence is a big one these days. Then a couple that I don't have on the slide is, privacy, billing, drug diversion. Some of those are really high risk areas as well. Next slide. So how do we monitor these risks? So we have a software that we now have in place, which has been very helpful and in reporting and the ease of tracking. You know, back in the day when we were on paper, you know, it was write it up, write this up. And it was kind of a negative, you know, response to, you know, reporting. So in our journey to a culture of safety, that was one of the things that we did was let's stop calling these write-ups or incident reports. So we started calling them safety events or safety reports. And that kind of stuck. And then once we went to our electronic software, it's a Verge system. So we now just call them Verge. And I think that's made the staff feel more comfortable reporting because it doesn't sound like it's as punitive. So we have had an increase in our reporting. But our software tool also, we can enter our employee events in there, our patient complaints, our staff complaints. We can also, you can also submit a compliment in there. And that is, you know, a nice side of reporting is when you get a nice compliment. And then we have our Good Catch program. The Good Catch program, we started it about 5 years ago. And it's another great tool for those near misses, those that almost could have happened events, and has played a key role in patient safety here at our hospital. We really make a big deal out of the Good Catches. We announce those on that safety call every morning. If we have one that's nominated, everyone gets recognized that has a Good Catch nomination. We send them a card and say, thank you. Thank you for participating in the safety of our patients, your vital and key role in patient outcomes. We, you know, we give them crackers, the goldfish, or maybe Swiss fish. And then at the end of the month, our patient safety council frontline team, they vote on the catch that would have the most impact or patient safety. Then that person is presented a certificate, a fish lapel pin, and a lunch card, and a Good Catch t-shirt. So if you have a fish pan and a Good Catch t-shirt, you are a celebrity at our hospital. So, and you're also put on our board. We have a safety champion board, and your picture is put on the board. So we're really proud of our program, and we have definitely had success in our program, and we will continue on that journey and to continue to encourage our just culture, our safety of culture, and encouraging those good catches, because you can learn just as much from your good catches as you can your actual events. So some of the different surveys that we also participate in, and the way we find out about things that we need to work on or events, is accreditation surveys, leapfrog survey, patient experience surveys. We get a lot of feedback on those. Our cultural safety surveys, that gives us the opportunity to see how the staff, do they think our facility is a safe place where they would want to have their health care or have their family members have health care here at our hospital. We also do assessments, daily assessments. Our risk management team is part of the readiness team for surveys, and that gives us an opportunity to see the staff on that visibility. It goes back to that. We created some flashcards, and when we do our rounds, we may ask about infection control practices, and they enjoy the card game, and we reward them with candy or whatever. So just in an effort to try to stay ahead and educate staff, we that is something that we do as well. Next slide. So this is my risk management or our risk management survey, and this is just a quick tally really of events when we go to when we go to a meeting, we have it handy. And I would be glad to share this tool with you as well. Next. And this is our Good Catch card, back to their Good Catch program. These cards are throughout the hospital. They're on like a 4x6 card, and the staff can nominate each other. And we also, you can enter a Good Catch, via the software or email, or we have mailboxes throughout the hospital that we can also accept nominations. We take all nominations. Just some examples of some of our Good Catches. And it's not only clinical staff that are nominated. It's the whole team. So one of our EVS workers was cleaning in the ER lobby and recognized that a patient was having stroke-like symptoms and alerted the staff and called an RRT right away. We had one of our CNAs. We have a lot of prisons in our area, and we get a lot of prisoners. But she counted the utensils before he went in, and she counted them after. And he had actually hid. This prisoner had hid the plastic knife under the bedsheet. So that one was a really good catch. We learn so much from these, and the staff do deserve recognition. Next. So identifying trends and areas that we need to work on is just key. And as I was saying a few slides earlier, there's many ways that we do this, but just tracking and trending and having our tools to see what areas that we need to work on. Next. So risk management education is ongoing, but we do new employee orientation as the risk manager goes down. We educate the new staff coming on board. Annually, we all have to have risk management education that's state mandated. And it's just, constantly, and as things arise, we continuously educate. So, and everybody it has to be, even our board members are educated on risk management. Our contract employees, our volunteers, our providers, even the patients and their family members as well. So if we do have an event, we do a deep dive, and we do a root cause analysis where we can peel back the layers and see what was truly the cause. We do know that most of the time it's a process problem. It's not a person problem. There's something wrong in our process that needs to be critiqued. So doing a root cause analysis gives you the opportunity to really do a deep dive. And one of the tools that I use a lot with the root cause analysis is the timeline sheet, and I can share that resource with you as well. Next, we do a parent root cause analysis. This is just a quick, and we do this one probably with most of our events or near misses. And it's not as a deep dive as the root cause analysis, but it's a limited investigation on the event with purposes to identify actions to address the problem. Failure mode, we do this annually. We analyze and see, what potential failures in a process or design could, lead to failure. So we do this one annually. And then action planning from all of those, whether it be a new policy or procedure, process change, or, maybe we do need to invest in upgrading some software. Maybe we need to update our equipment, more education, set different goals, and follow through. That is one of the keys is, when you when you work on something, is to follow through, and make sure that everyone is aware. And that's another thing is, trying to make sure that the staff are aware of these new policy changes and process changes, because it does us no good if everyone doesn't know what we need to work on or what we need to change. So that's all I have. Anyone have any questions?
This is great. Thank you so much, Beth. I know we're coming up to the end of the session here. There were some questions in chat about the Verge program that you use too. So I'll let you and give you a chance to kind of go in there and see those. There's some great resources here. And then Beth's also going to share some